Hi, everyone. I'm so happy to be here with all of you. I'm Assemblymember Rebecca Bauer-Kahan. I have the privilege of representing the Tri-Valley in the California State Legislature. And today we're going to spend some time with all of you, our Tri-Valley residents, to catch up on what's happening at the state level with respect to COVID-19 vaccines and to answer some of your questions as well. Hopefully we'll get to all those questions, but sometimes it's hard. So before I go on, I want to just give one housekeeping note, which is if you want subtitles for the presentation, you can go to live transcript down at the bottom of your Zoom screen. It's a visual icon. Click on it and adjust the subtitles, and you can turn them on or off. So if that's helpful, go ahead and do that right now. Also, we're going to hear from both of our presenters. We have two wonderful individuals who work in public health with us today. And then we're going to take Q&A. So if you have questions, feel free to put them in the Q&A feature, and you can type them down there, or you can put them in the chat if that's easier. And we'll try to get to as many of those questions as possible when we get to the Q&A section. So thanks for being here. And I have to say that I'm optimistic. And I was on the phone yesterday with Dr. Moss, who is here with us, and a colleague of mine said, this was a good call. I think we're finally seeing the light at the end of this tunnel. So thank you for being here with us. Part of that is the ramping up of vaccinations in our community and our ability to continue to reopen. So starting on March 1st, the state set aside 10% of our vaccination allocation for our teachers and our school workers. And we did that so we could get our kids back in school, which is a huge priority for me as your legislator, for me as a mom, and for the state. So we are on our way towards that, and hopefully we will see all of our kids back in school soon. And now coming up on March 15th, individuals with qualifying medical conditions will become eligible to receive their vaccines. And that's an important change that is coming not too long, next week. And healthcare providers will ultimately make that decision, although we can ask our guests if you have questions on this specifically. But those aged 16 to 64, so those who are not yet eligible, but are deemed to be at the very highest risk of getting sick from COVID-19, will be eligible for vaccines. It'll include patients with severe conditions such as cancer, chronic kidney disease, heart conditions, and others. And you can learn more about those criteria by visiting the CDPH website. And perhaps someone on my staff who is more at the ready can put that link in the chat so you can see that link of who will be becoming eligible on March 15th. And I know the vaccines have been incredibly high demand, and so does our state leadership and our local health experts who are here today. And so that's why my turn is coming your way, or has already come your way, as a way to sign up, both if you're eligible to sign up for a vaccination, but also you can sign up there to find out when you're eligible, which is a good tool to get information as soon as you're eligible to be vaccinated. And you can do that at myturn.ca.gov. Now, I know you're all joining by Zoom today, so everyone on this call is very tech savvy, but not everyone is, and not everyone wants to sign up on a computer. So if you prefer a telephone line, it's 833-422-4255. And you can sign up for an appointment there, or they can sign you up for those notifications. I also want to touch on something that we've been hearing a lot from our constituents, which is concerns about the shifting vaccine eligibility, that it hasn't been consistent, that you thought there was a trajectory we were on, and that it's changed as we've been distributing vaccines. And that has been, I want just to assure you that that has been driven by science and by our public health experts who make these decisions, by how much vaccine supply we've had, which was not predictable at times. But we really are working to ensure that we're allocating those resources to the individuals whose lives will be saved. Our goal is to save the most lives and protect the public health. And that is how those decisions are being made. So I know it's been frustrating, and I hear you, but I want you to know that it is always coming from a place of science and of saving the most lives, which is obviously critical. So in addition to our seniors 65 plus who've all been eligible, those in long-term care facilities, our essential workers in healthcare, public safety, emergency services, education, childcare, and the food chain workers, including our farm workers here in the Tri-Valley, who serve our public every day and face them and have been putting their lives at risk throughout this pandemic, are now eligible for the vaccine. And on March 15th, again, those who have medical conditions will be added to those groups. So I just want to say that we as a legislature with the governor have worked to ensure that the public health system has the necessary funding to administer vaccines and coordinate the programs that will vaccinate our communities. And that means the large vaccination sites that you all have access to at the Oakland Coliseum and also in our backyard at the Alameda Fairgrounds. I had the privilege of going to see the Alameda County Fairgrounds site with Tracey Taylor, who's here today from Stanford ValleyCare. And, it's these large vaccination sites that are going to help administer vaccines as quickly as possible, protect our residents, save lives, and get us back to the new normal. So we'll be hearing more about that site and how you can access it a little bit later. But one thing I want to touch on also is that we want to make sure those vaccines are distributed equitably and that we're helping to get our community on the road to recovery with investments in individual relief, that we're giving relief to our small businesses and funding to our schools to get them reopened safely. And I want to say this pandemic has challenged all of us and it continues to challenge us. And we recognize that and we're working hard to get us to a wonderful and positive recovery. So I thank you all for your diligence. Just yesterday, the governor in his State of the State talked about how many lives we saved with the measures we've taken by masking, by socially distancing, by staying at home when public health officers have asked us to. So thank you. And now we're asking you to get vaccinated. So thank you for being a part of that effort as well. So, and thank you for being here, by being here for information for yourself, but also information you can share with friends and family. It's really critical that we're able to get good, accurate information out. It's something I've worked on throughout this pandemic and will continue to work on as we move forward. So with that, I want to thank our two guests who are here today. We have Dr. Nick Moss from the Alameda County Public Health Service, who has worked tirelessly through this pandemic to keep Alameda County safe and now to get them all vaccinated as quickly as he can with the supply that he's receiving. So thank you for being here, Dr. Moss. I know you're busy, so we appreciate it. And we also have Tracey Taylor, who's the COO of Stanford ValleyCare, who just in the Tri-Valley's backyard is working every day from the start of this pandemic to set up testing, vaccination, and take care of COVID positive patients. So thank you, Tracey, for being here, and we look forward to the update you have for us. But before we get there, I want to give you a little bit of an update on what's happening in Sacramento and what we are doing to help you get through this. This year has been tough for all of us, but us as a legislature. But we have fought alongside one another for a budget that responds to the needs of the most vulnerable Californians, our seniors, our children, our small businesses, and those who need medical care and medical coverage. And I hope you can see that in the actions that we've taken. And I want to touch on just a few of them. But first, I want to say that while our tax revenues have continued to exceed expectations by a lot, we're still dealing with a $5 billion deficit. So we're working hard to reduce that deficit, to continue to focus on investing in California's recovery, on providing resources to those hardest hit by this pandemic, and putting money away in the rainy day fund, because we know we will need it in the years to come as our deficit grows. So just last week, the legislature passed AB 86, which provided $8.6 billion, both to support the reopening of schools and to address the learning loss that we know our students have faced this year. I'm a mom of 3 kids that have been on Zoom school for almost a year. And so I know firsthand that we have a lot to make up for, and we want to make sure our school districts have the resources they need to get our students back on track. We also took early action on homelessness. We already had a homelessness crisis before this pandemic. And we want to ensure that it doesn't exacerbate that by putting those who haven't been able to pay their rent because they've lost their jobs, because their small business couldn't put them to work, ending up on the street. And so we passed on $2.6 billion in federal funds to pay for the rent for those folks, to make sure our landlords have the money they need to pay the mortgage, because 70% of California's landlords are small landlords that need that money to keep the roof over individuals' heads, but also so that individuals wouldn't get evicted. Just in the past few weeks, we passed the Golden State Stimulus, $600 of one-time relief to households in California receiving EITC. So for families who need it the most. So on top of the federal relief, we're sending additional checks from the state of California. That's a 5.7 million payments to low-income Californians. And it's something I'm really proud of, and I know my colleagues are as well. We've also sent relief to our small businesses. We know they're critical to our community. We all love visiting our small businesses for whatever it is we need. And so we want them to make it through this. And so we passed $2.1 billion in grants for up to $25,000 per small business to help them get through this. We also made sure that those barbershops and restaurants with alcohol licenses don't have to pay the state their fees. Don't worry about it this year. We got you covered because we know you're struggling. So we keep taking actions we can to support those small businesses. We also are, as talked about school, I want to talk about childcare. Childcare is so critical. More women have left the workforce during this pandemic than any of us could have anticipated. And so we have to be supporting to get women back in the workforce, to get our economy going again. And so we passed $400 million in federal funds to provide additional aid for childcare and preschool resources. And we're going to be able to cover 8,000 more children in childcare. So again, every step we can take to get our economy moving. We passed $35 million for food banks, focusing on food insecurity. So we're doing everything we can to get California through this and to get it up and running again. So that's a little bit of what we've done in the budget. And I want to touch on the legislative package that we're moving in the year to come. I want you to know I haven't forgotten the values of this district and the values I hold and the things that aren't going to wait because of the pandemic. So climate change remains top of mind for me. Wildfire prevention is really critical. It didn't take a break because of the pandemic, and it won't. And so we continue to move legislation to prevent wildfires in our own backyard and across California. I'm continuing to work on gender equity issues and protecting the fundamental rights of women to choose their own future. I'm working on criminal justice reform and increasing access to mental health care. Working on consumer protection, and every day I work to get our schools back open so our students get the education they need. So you can check out on my website everything we're up to. We're very busy. The staff in my office is incredible, and they are working all the time. They're remote, just like most workers in this sector, but they are available 9 to 5 to answer your calls if you need them. So please reach out to find out more, to let us know your opinion, or to get assistance from us. But now, for the reason you're here, we're going to turn it over to talk about Alameda County's COVID-19 response and vaccine administration. So first, I'm going to turn it over to Dr. Moss. And again, I so appreciate all your hard work during these difficult times and your ongoing partnership to make sure that we get vaccines to those who are eligible, be it our seniors or our farm workers or our teachers. So Dr. Moss, can you tell us more about what's happening in Alameda?
Sure. And first of all, just wanted to thank you, Assemblymember Bauer-Kahan, for having me here today. You mentioned we're busy, but actually this is the work, connecting with your constituents to talk about what we're doing. And I also want to thank the legislature for all that it's done to support public health and through the pandemic here in California. We can, tell people that there's this restriction or that restriction, but the things that the legislature is doing to actually support businesses, individuals, schools, all those types of things to get through this are so much more important in a lot of ways. And of course, I want to thank you for your leadership and health and safety issues in general. So I have some slides. We're going to skip a bunch because I think that the discussion is going to be really valuable today. And I know there's more to come in the presentation. So if you see something that you thought was interesting, please let me know. Can people see these okay? I lost my Zoom window.
I don't see slides, but maybe it's just me. Tracy's saying no too. So.
Here we go. How about now?
There we go.
All right. So, so some key points, just where we are with the epidemic here in Alameda County right now. Similar to what's being seen across the state, our daily case rate, number of new cases reported every day, has fallen quite a bit from the peak of the winter surge. We're at much lower numbers now. Test positivity, that's kind of a rough marker for how much COVID is circulating, that's fallen quite a bit as well. We're very in a much better position than we were. And also the number of people in the hospital. And although we've lost far too many people to COVID, the number of deaths that we're seeing right now, all of those have decreased as we've come out of the winter surge. I do want to note the winter surge was marked by these persistent racial and ethnic disparities that we've seen throughout the COVID pandemic. And of course, a heavy toll on older adults. So those things did not change during the winter surge. Just a brief comment on variants, because people are concerned about the impact these will have on the epidemic. Well, we have had a couple of these, what the CDC calls variants of concern, reported in Alameda County, just a handful. All of them are related to travel, at least the ones that we know about. Our visibility on variants is fairly limited. But but I would point to just the overall improvements in the epidemic locally as the most important thing. So that's a reliable measure. We can look at those numbers. We see that we're doing well. So we know these things are out there. We know we need to keep doing the things that keep ourselves and our neighbors safe. But I think the overall message is that we're in a little bit better place now than we were. Future surges are possible, and so this isn't over. We have a lot of work to do, both with vaccination and sticking with the things that work for the time being. But fortunately, we're at lower levels of virus right now. So I'm going to skip these figures. But anybody who's interested can go look at our Alameda County Public Health Department dashboard and take a deeper dive into our data. Just a brief note on the shelter-in-place restrictions that we've been living with for pretty much a year now. So as you know, those tighten up and loosen. Right now, we're in a time where they're loosening. We're in the red tier in the state's what's called the Blueprint for a Economy. That's the state's restriction framework. That's effective today. That means indoor dining is allowed, movie theaters can operate, indoor museums, gyms. All of those are subject to capacity limits and some other restrictions. And also K through 12 schools can all open in the red tier. Of course, there's a lot of restrictions there as well. And I know that it's one thing to say they can open and another thing to actually get everything in place for them to open. But nonetheless, that's where we are as a county. And I expect if current trends continue, we will be able to progress to the orange tier in the not too distant future. I'm going to skip some of the details of the blueprint just in the interest of time, but happy to address those during questions. And so what about vaccines? So right now in Alameda County, and I feel like I missed the slide here. There it is. Vaccine key points. So 400, almost 500,000 vaccine doses have been delivered to county residents already. That's terrific. We have about 1.7 million people who live in Alameda County. And then people should remember we don't have a vaccine approved for children yet. So when we look at people 16 and older, those who could receive one of the approved vaccines, over a quarter of them have received at least one shot here in Alameda County. And over 10% of our residents are fully vaccinated. When we talk about older adults, people who have been at greater risk for severe disease than many others, almost 2/3 have received at least one dose of vaccine. And you do start to get protection about a week or so after the first dose, although you're not fully protected until you're 2 weeks out from the last dose, if it's a 2-dose vaccine, or 2 weeks out from your one dose, if it's the 1-dose vaccine. We'll talk a little bit about ways to get vaccinated here in Alameda County and eligibility. I know the Assembly member touched on some of this. So healthcare workers have been a priority all along, people in long-term care facilities, but also now food, agriculture, restaurant workers, grocery workers, emergency services workers. These are big categories. Lots of county residents are eligible. And of course, education workers can all get
Did we lose Dr. Moss? Okay, well, he may pop back on. This is the problem with virtual events. Did he pop off? I think he may have popped off. So we'll see if he rejoins us. But I have to say that those numbers are always so inspiring. A quarter feels good if people vaccinated. So I'm happy to hear that in such a large percentage of our seniors. So we'll get more from Dr. Moss when he rejoins us. But in the meantime, let me give Tracey Lewis Taylor a chance to talk about what's happening locally in Alameda County. Stanford ValleyCare has been a huge partner in what we have seen go down at the Alameda County Fairgrounds from early in the pandemic, the testing that was set up there that they were integral in making happen, to now our vaccination site there that they helped coordinate and are vaccinating several of the lanes at the fairgrounds. So Tracey, can you talk about what's happening in the Tri-Valley?
Absolutely. I think Dr. Moss is just rejoining. So Dr. Moss, if it's okay with you, I'll just continue to share a little bit about what's happening at the Alameda County Fairgrounds, and then I'll turn the floor back over to you to continue. What I'm really proud of, and certainly thank you, Assembly Member, for the really wonderful introduction and recognition of this incredible and exciting partnership. I'm excited about the partnership that we've had with the county to stand up a large vaccination site within the Alameda County footprint. What I think is probably transparent to most individuals, but it really is a strong partnership between the county, between Stanford Health Care, ValleyCare, and between Sutter Health System. So each of us operate somewhat independently, but with a lot of shared structures and services. And we have a really great working relationship where we are able to vaccinate large amounts of individuals on a daily basis. So what's really important for me to mention here on this particular call is how someone can get vaccinated. And again, I know, Assembly Member, you mentioned My Turn and having that as a central portal for more information and to sort of understand where somebody might be in terms of eligibility and notification. In addition to that, my best resource is actually the Alameda County website, as well as the website directly for the Alameda County Fairgrounds. Those are two places that I go often for information. And each of those sites has different links to not only the vaccination opportunities that are available through the county, but certainly those scheduling links that are available through both Sutter Health System as well as Stanford Health Care, ValleyCare. And again, we know that there are individuals who may not prefer to get their appointments scheduled online via technology. So I will also share a phone number. This is the phone number to the centralized call center within Stanford Health Care. That number is 650-498-9000. And I'll make that plug. I know that Sutter also has a direct phone line, but I'll make the plug for Stanford Health Care, ValleyCare, because our vaccination process and scheduling capabilities are open to everyone who is eligible. You do not need to be a Stanford patient. You do not need to be a Sutter patient to receive a vaccine at the Alameda County Fairgrounds footprint or at any of our other sites for that matter. So I think that's a really important message that I want to share. Additionally, there are several ways to make an appointment, whether it is through the online scheduling portal or the direct scheduling number that I just mentioned. And for those that may have language barriers, that phone number is really important. We have a language line that will meet our patients where they are in terms of different languages. And we have over 100 different languages that we service through that line. And we do that as part of our standard of care, not just for vaccines, but our standard of care across all of our different service lines. So just wanted to make sure that I mentioned that as an opportunity as well. So again, really important to note that we absolutely follow and stay within the guardrails of the Alameda County eligibility framework. So we will not offer eligibility or vaccine appointments to those that are not already eligible within the county's framework as well. And we share that information right on our website. So again, my advice, different sources of information, Alameda County Fairgrounds is a great resource. The Alameda County website, also a great resource, stanfordhealthcare.org, and certainly sutterhealthcare.org as well.
That's so good to know that anybody can call Stanford. I wouldn't have known that. So thank you for sharing that, Tracy. I have a question. So when it's a really important point you make about eligibility. For those that will be confused starting next week when they have an underlying health condition, but they don't know if it qualifies them, does calling the line help them figure that out? Or how best should they identify if they're eligible next week on March 15th?
Sure. So it's going to vary by health system. So I'm going to speak sort of generally in broad terms. So regardless of who your healthcare provider is, but if you have a question about whether or not your underlying health condition meets the eligibility requirements, certainly sort of first and foremost, check out the county website where all the eligibility criteria are listed out in detail. And if there are other additional questions that you may have, my advice is always to contact your provider to seek additional information.
Awesome. And this might be a question for both of you, but I know that we all got used to access to testing at the fairgrounds and elsewhere. Now the fairgrounds is vaccines and not testing. So where's the best place in Tri-Valley to go if you need to be tested? Because we still want people to get tested. They have reason to.
Yeah, again, happy to answer that question. I'll say broadly, there are several different testing sites across the county. I know that areas like CVS and urgent cares often do provide testing as well. In addition to that, we still offer testing within the Stanford Health Care ValleyCare footprint. So certainly we've got opportunities both in Pleasanton as well as Livermore to be tested. So many healthcare providers are now offering testing as part of their standard of care. Certainly if somebody is symptomatic, always the best phone call to make is to your provider. And then certainly a number of different options out in the community.
Awesome. Thank you for all of that information. We're going to have more questions for you, but we'll take it back to Dr. Moss. You missed me quelling over how many vaccines you've given, and especially to our seniors, but I will turn it back over to you so you can resume where you left off. I don't know if you want to share your slides again.
Sure, I'll do that. And I'm almost done. Oops, and I'm not even sure I can. So the only reason I wanted to share them is you mentioned a rainbow earlier in the call, and I have a great photograph of the fairgrounds with a rainbow over them. But anyways, oh, here we go. We'll do it.
I love
this
that
was
picture.
The very first day that the fairgrounds was operating, and this is no Photoshop. This is really everybody was very moved by this hopeful sign. The clouds are parting as we get people vaccinated here in Alameda County. And then, so you heard about the fairground site. Just mentioned the Open Coliseum site. It's a state-operated site with a federal vaccine supply. So it pretty much doubled the amount of vaccine coming into Alameda County. Now it is open to, people from outside the county are able to access vaccine here, but a lot of appointments, and these can be accessed through My Turn, which you've heard reference. The links in the chat for both the fairgrounds and the Alameda County vaccine site are great links. I would go there to get more information. And so I'll skip this slide. I'll skip that slide. I did want to briefly comment on the Janssen or Johnson & Johnson vaccine. They're the same thing that was approved for emergency use. The most recent one. This is a highly effective vaccine at preventing severe disease and death. It's very safe, and it's one dose only. It was tested and has efficacy against one of those variants, B1351. There in that is circulating in South Africa and other parts of the world now. So it's an excellent additional vaccine. Just a reminder, you hear a lot of things about this vaccine or that. None of these have been compared to head in the same populations with the same measures at the same time. And so you can't really compare them directly in that way. They all perform great in clinical trials, and I would be happy receiving any of them or letting any of my family members receive any of them. So take the first vaccine that you can get. The most important thing is to get protected from COVID when it's your turn. Just a last final reminder for people, it's not over. Wear a face covering, please. Wash your hands, watch the physical distance, Wait to see loved ones, with the caveat that now, smaller gatherings are okay outdoors with face coverings. And of course, when it's your turn, get that vaccine. So that's it for my slides, and I apologize for the disruption. But that's life on Zoom.
It happens. We understand. Thank you, Dr. Moss. I had a question about that last slide, which is the CDC came out with guidance yesterday talking about our ability to gather indoors without masks with those that are vaccinated. I know my children's grandparents are fully vaccinated now, which makes me happy. Is it safe for us to do indoor gatherings without masks? It differs a little from what you just said on the slide.
Yeah. So we're really excited to see the new CDC guidance. We're looking to the state to update its blueprint restrictions to see if there are going to be any changes there. Really, that's what applies here in Alameda County from a sort of a shelter-in-place restriction standpoint. But I do think that they'll take a look at those, and we may see some adjustments by the state. The bottom line is that vaccines prevent people from getting sick. We know that, and that's what was shown in the trials. And we're just starting to learn that they probably also reduce the chance that you could pass COVID on to somebody else, even if you got an asymptomatic infection. And so that's why the CDC has come out with these updated guidance. But you have to be careful. It really only applies in some limited ways. And so, yes, if you have two vaccinated people getting together indoors without masks on, that's fine. If somebody is not vaccinated or you don't know, there's a chance that they could get COVID. They could even get COVID from somebody who's been vaccinated. And so it's really important to either wear masks, or in very limited situations where that unvaccinated person is low risk, they're an adult, a younger adult without any health problems. In that case, getting together with that person is probably okay. But we're not talking about getting lots of people together without masks, getting lots of people together indoors. We're just not at that place yet, even with this new guidance. So I think that, look at those CDC guidelines. There's a few limited situations where people could let their guard down a little bit. But for the vast majority of situations, keep the mask on, limit the gatherings, and we'll get there. We will get there soon. But it's going to take a little more patience.
Well, thank you for that. I appreciate it. So I want to touch on something else you talked about, which was the Johnson & Johnson vaccine. I know there's a lot of questions about it and how it differs from the other two. And I appreciate what you said about get the vaccine that's available to you. But can you talk a little bit about how it's different from the ones that we've now become accustomed to, Moderna and Pfizer?
Sure. So let's see. The biggest difference from the standpoint of a person who's getting vaccinated is you only need to go in for one dose. You don't have to come back 3 or 4 weeks later to get that second dose. It's also really well tolerated. They're all really well tolerated, but it actually has an even better side effect profile just for that day or two after you get the shot than the others. And so, I think those are good things for people to know. But the fact is that any of them are good, and we're going to try to get them into our various sites that are distributing vaccine. And you might end up getting one or the other, and that's okay. They're all going to do what we want them to do, which is keep people from getting sick, keep people from getting in the hospital, prevent loss of life. And so really that is the most important thing. The single dose with the Johnson & Johnson vaccine is a real advantage for some people. For a variety of reasons, that's going to be the best option for them. But again, I think whatever that you can get your hands on is going to be a good option. And pretty much anyone can receive any of them. The other difference is that they are a little bit, they're made a little bit differently. So there are different ways to make vaccines, and all the vaccines that we have in our lives, childhood vaccines, flu vaccines, there are different ways to make all of those things. So because there was really a huge global effort to develop COVID vaccines, and It's not always clear when you start what's going to be the best option. People tried a few different strategies. And what we're seeing is that more than one strategy produces a really good, safe, and effective vaccine. So you've got what are called the RNA vaccines. That's Moderna and Pfizer vaccines. And it's a little fragment of genetic material that produces a protein similar to the one that the virus produces and stimulates an immune response to that protein. The Johnson & Johnson vaccine is a little bit different in the way that it stimulates that protein in your body and stimulates an immune response. But the overall goal is the same. It's to expose a little sort of a copy of a piece of the virus to your body's immune system and train it up to fight against natural infection. And turns out that they both work, even though, or the three of them all work, even though the Johnson & Johnson vaccine is a little bit different type of vaccine. Does that answer the question?
I think so.
Okay.
It answered my question.
Is that too much?
I have so much gratitude for the scientists that I know have worked probably long days to get us to this point of 3 successful vaccines in a year is just, I know it's historic and it's also incredible. So
and I would also just add to that gratitude for the hundreds of thousands of people who signed up to get these early before they were approved by the FDA and just show us all that not only do they work, but that they're safe. And so, I don't think we thank those people enough.
So true. Thank you for that, Dr. Moss. So we have a question from the audience about how the Alameda County vaccination plan has changed, if at all, since getting the Johnson & Johnson vaccine. Are you doing things differently now?
Well, we might have it in hand today. I don't think we, over the weekend we heard we were getting it. And so we are just incorporating into our supply. I think the most important thing is that, it's an option and it's going to be in, something that we distribute at a range of sites, and other providers are going to get it and distribute it at a range of sites. So people are going to come across it. But we do want to be able to reach some people. It's a good option for situations where it might be hard to arrange getting a second dose. And so an example of that is people getting discharged from the hospital where, they might not easily get an appointment for a second dose without a lot of work and effort on their part. And some people, that's an easy thing, but for others, that's a real barrier. And so, we are working with our healthcare network and looking at taking advantage of the single dose in that situation. And there are other populations where if we're going out in the field and we're doing, vaccinating small numbers of people at once, where we might not encounter that group easily again. For example, unsheltered populations. There's a couple things about the Johnson & Johnson that are advantage. One dose and you're done. And the other actually is that the storage requirements are a little easier. It's just refrigeration. It's a little easier to transport. So it has some advantages if you're going out in the field and doing sort of field vaccination programs, which could reach any of a number of different populations. So those are some things that we're looking at. But again, just getting started.
So that touches on a question that I had for you, which is, what about our homebound individuals or individuals who can't get to our vaccination sites? What is the plan for those folks to be vaccinated?
Yeah, well, so we've already started for homebound individuals that are living in congregate facilities or living by themselves, but maybe in like senior housing communities, things like that. We are already working in partnership with some local pharmacy chains and others to actually go do vaccinations on site at those locations. I think the thing that is still in planning stages right now is how to reach homebound individuals who don't live in those kinds of settings. And, if it's people who can make it to their medical provider, who have a medical provider, that's going to be a great option. But for some, homebound really means homebound, and it's not so easy to get out of the house, even to a doctor's appointment. In that case, we really are trying to develop a system where people who are, organizations, home healthcare organizations and things like that, that actually go out to those to people's homes, that's the type of work they do, that we could help plug those organizations in and take advantage of their expertise to deliver vaccine to people where they live. There's some the wheels are still kind of turning there. You have to have some we have to pay them for this service. You have to have some contracts in place. We have to make sure we know who it is that we want to reach. But that's one of the ways that we're trying to reach into this population and get these people vaccinated. And so hopefully we'll be able to make progress on that in the next I would say 6 weeks or so. Top priority for a lot of people.
That's great. And I know that you told me yesterday that if folks go onto your website, there's a box where they can put that they're homebound and they can get more information about that program as it becomes available. Is that right?
That's right. In fact, anyone can sign up on our website for alerts about their eligibility. And we do want to collect information on that so we know who we can reach. But, as you know, not everybody's that's not going to be enough. We have to do more than rely on people to sign up on our website. So, so we're working on it.
Awesome. Thank you. Okay, Tracey, I have a question for you. Many of us have heard about the third-party administrator that's coming in. Things are going to change in California and how vaccines are being distributed. And so can you talk about how it might shake up the fairgrounds? Is everything going to be okay? Let us know.
Sure. I'll speak from my perspective, at least from the Stanford Health Care, ValleyCare perspective, and certainly invite Dr. Moss to speak from the county's perspective as well. But I think what's really interesting, and maybe I'll back up and set a little bit of context for our viewers in terms of what even this means and why this is relevant, at least again to entities like Stanford Health Care, ValleyCare. Currently, and this is sort of my layman's approach, so Dr. Moss will correct me if I go astray here. There's an allocation of vaccine that goes to the state. The state then right now has two different sort of pathways for distribution of vaccine. The first is to what's considered multi-county entities, those large health systems that have footprints in multiple locations or multiple counties. The other sort of distribution mechanism is then directly to the counties, where the counties then distribute doses to healthcare entities, and then keep some of the doses, obviously, for all of the great work that they're doing to directly vaccinate individuals as well. So there's sort of a tiered or tree approach to distribution. As the state shifts to this Blue Shield agreement, there are more entities that will receive doses directly from the state. So in this shift for Stanford Health Care in general, our current process is that across the Stanford system, we receive doses from multiple counties, since we have footprint in San Mateo, Santa Clara, as well as Alameda County. And so in this future state, the larger Stanford set of entities will now receive doses directly from the state. So in terms of continuity, we have every hope and confidence that we will continue to be able to provide vaccines in the way that we do today across all of our counties, but the mechanism to acquire those doses will shift directly from the counties and move over to the states, to the state level. This shift is supposed to happen in the next week or so. So obviously we're in active conversations regarding that transition, but we are also in very active, engaged conversations with the counties directly. I can speak again from Stanford Health Care, ValleyCare perspective and the relationship that we have with Alameda County. We have a fantastic relationship. And so we are working collaboratively and in lockstep to mitigate any risk of impact to our day-to-day operations. So that's always our number one goal, is to make sure we're continuing the great work that we're doing in our key areas.
Yes, well, thank you. I had mentioned earlier that Dr. Moss and I were on a call together yesterday, and this is one of the things we were talking about, is that we at the state are doing the same to work to make sure that although this change, hopefully it will speed up distribution, right? Sending it directly to you could be a real positive move, and that's the goal. And by no means do we want this to have any impact other than increasing access to vaccines. So change is always scary.
Yep.
But
Well, I was going to say it's a shift which just represents change. And I think in healthcare, in other industries, to the viewers, what we've learned over this last year is to be nimble, to be flexible, to be resilient, and that's what we are prepared to do. So we are going to continue our operations and work with the various partners that we have to make sure we get doses in hand.
Well, thank you for all your hard work on that. So, Dr. Moss, we've got a couple questions about the vaccines themselves, efficacy and side effects. So I want to touch on that. Celia asked about the long-term effects of vaccines and what we know about, do they cause infertility? Could it shorten your lifespan? Are there long-term negative impacts to being vaccinated?
Great question. The vaccines in general are not known to have those kinds of effects. We have many vaccines that we use, and they're profoundly beneficial in terms of preventing loss of human life, and I think probably have contributed to public health and economic health and vitality of our lives in ways that I think people don't always realize. They are incredibly beneficial. Now, these vaccines are new. They're extremely safe, and the more we learn about them, the more we know that they're safe. I think we've got, I'm not sure what the global totals are, but millions and millions of people worldwide have now received these. They're being closely monitored because they've been approved under this, in the United States, under emergency use authorization. So we do want to make sure that even though it's an emergency use, that it's still safe. And I would say that it's extremely reassuring, the data that we have back so far about safety. Now, I think we'll learn more over time as we spend more time with these vaccines, but given how they work and given what we've seen so far, I just see no reason to think that there would be any long-term safety concerns. The vaccines themselves, the products of the injection, those are out of your body in a matter of probably days. And so really, you're creating an immune response analogous to, but stronger than your immune response to COVID. And they're just, I just can't believe that we're already at this place where we have extremely effective and extremely safe vaccines right now, and we're putting them into people's arms. So much better than having people die of COVID.
One of the things I think that I learned early on when these vaccines were coming is that the technology itself, or whatever you call the underlying science that these vaccines are based on, is not new, right? So these vaccines are new, but there's the scientific understanding of how they work that is well established and gives more confidence in the long-term impacts. Is that right?
I think so. People wonder about like the Operation Warp Speed and all went so fast. So these vaccines, we now have, as we talked about before, two different types of vaccines: the RNA, and then the Johnson & Johnson is a viral vector vaccine. Works a little differently, but all of these technologies have been around for years. In development for years. And what happened was when COVID happened, we were able to build on work that had already been done, work that had been done based on SARS, which some people may remember from 20 years ago now. There was a fear that this kind of global pandemic would happen, and it didn't take off. But we were able to build on our past experience with that and other viruses, and vaccine research that's going on all the time, and sort of plug and play. And then the other thing that happened is the taxpayers of the United States of America, funded a extremely fast development process where there were basically the financial risk was removed from the equation so that things could move very quickly. But the actual clinical trials checked off all the boxes. They were normal full-size clinical trials in which the appropriate outcomes were looked at. And the one thing is that they're ongoing and we're still learning. And so I think we'll continue to get data from those clinical trials that'll inform potentially moving from emergency use to full approval. But other than that, where no corners were cut in the clinical evaluation of these vaccines. We were just able to build on work that had been done for years going into them.
Yeah, that's helpful. Thank you. I know that we got a question from Michael about, do we believe this is going to be like the flu shot, where it's something we're going to have to take annually? Do we have any sense of that at this point?
Yeah, well, so we don't know yet. I think that it's reasonable. We are learning that COVID's a new virus. It didn't infect humans at all until a year ago, and it is adapting. And it's adapting to infecting humans. That's why you're hearing these stories about variants. This is a natural part of what happens with viruses, and it's not surprising. It's to be expected. It's something we saw from the beginning with COVID, although it's hit the news more lately. But it does mean that as it changes and as it reaches a little bit of balance, as a human virus and no longer a bat virus, we may need boosters. We may need an additional shot, whether that's an annual thing, a once in a while, or we all get it a year or two from now and then we're done, remains to be seen. But I do think there's a possibility that we'll have to get at least some booster at some point in the coming few years.
Yeah. Okay. Well, we'll wait and see. And I think hopefully many of us will be ready if we need it. But you touched on something important, which is the variants. I think there's a lot of concern amongst even those who are fully vaccinated that the variants will make them able to get sick from COVID. What do we know about these variants and how effective the vaccine is against them?
Yeah. So, and again, I think this idea that variants are new is a little misleading. It's part of the story of this and other viruses. They're error-prone, tiny little organisms, and when they make errors, when they reproduce themselves, that can lead to these variants. And so, so the question is, are the variants more severe, or do they spread more easily? And it does look like some of these variants spread more easily, and some of them are able to infect people who are previously infected. But that doesn't mean that the vaccines don't work. What our goal is really to keep people from getting severely ill and from dying. And that's so far, we don't see evidence that our current vaccines are going to fall short in that respect. And so, in fact, it's quite the opposite. The less COVID we have circulating, the less chance there is going to be for a variant to pop up that can evade these vaccines. All the more reason to get people vaccinated as quickly as possible. But beyond that, the other thing is all this other stuff that we know works for these variants. They're still COVID. It's just COVID. Wear a face covering, limit your gatherings, limit crowded indoor spaces. Those things will protect all of us from new viral variants that may be circulating. I think right now, that is the most important message. Get vaccinated, stick with the things that work, and that will help us even with this, these phenomenon, these new variants popping up.
Yeah, it's important to keep in mind. Thank you for that. So we have a question from Kyoko about, you talked about how many vaccines we're getting weekly when you did your presentation, but what does the forecast look like? Is that going to go up? If so, when? Joe Biden said we're all going to be vaccinated by the end of May. So what do you see coming?
I think, so supply has been okay and stable in Alameda County, get around 40,000 doses per day, with a huge boost from the federal government with the Oakland Coliseum site, kind of double the amount of vaccine coming in. We do expect that amount to increase, but it's not going to increase dramatically. It's going to be a little bit more starting in early April and then a little bit more after that. So I think, we are on pace to maybe by the end of May have a large portion of our county residents vaccinated. If we can get to everybody by then, I think that would be, that would be a great achievement. Probably going to get close, maybe not quite there. But it also requires residents to sign up and get vaccinated. If you're eligible, and you don't have a reason not to get one of those vaccines, we need that to happen in order to get the full benefit of these for the whole county and for everyone. And so so it's one thing to get the supply in, but the other is we want to get people out and get vaccinated.
Yeah, that's a great point. So then we got a question, which to me is the scariest question, but I'm going to ask it anyways. Somebody asked whether you foresee a spring surge.
Yeah, good question. Predicting the timing of these is not that easy. We knew there was going to be a winter surge, and so that sort of came to fruition with vaccines. And now we've had a lot of people infected. That could impact the timing and the magnitude of a surge. And it's difficult to say for sure. I think that if we just let everything get back to normal, take off your mask, go about your business, we would absolutely have a surge. This thing will keep coming back until people are immune. And we have a lot of people who have been infected, but far more who have not yet been affected here in Alameda County. And so I think, it's a good argument to stick with some of these restrictions, kind of a smart, slow lifting of restrictions, stick with the vaccinations, and that might kind of help fend off the spring surge as long as possible. The other thing is the weather's getting better, and that there may be a seasonality to this. And so that, for reasons we don't totally understand yet, we may not see a surge until later in the year. But I do think there is a risk of one.
Okay, well, I will keep wearing my mask for sure. Thanks for that. And I know everyone who's listening will too, because you're here, so you care, and I appreciate that. So 2 quick questions. One is, do you have to be an Alameda County resident to be eligible to be vaccinated in Alameda County? That's one of the questions we got.
Yes, we are vaccinating at the county-operated sites, people who live or work in Alameda County. If you work here and you're eligible, you can get vaccinated here. Tracey, you could comment on the fairgrounds if specifics there. The Coliseum is different. It's a more of a regional site, although we are hopefully getting as many Alameda County residents vaccinated there as possible. Tracy, yeah. I don't know.
Sure. What I'll offer up, and again, certainly speaking for Stanford Health Care, Stanford Health Care, ValleyCare, and I would imagine our partners over at the Sutter Health System as well. We recognize that we have patients that reside in different counties. And so certainly we would continue to offer vaccination opportunities to individuals who may not live in Alameda County.
Thank you. And I think that's all the time we have. I know we got one question about additional essential workers. We talked, both Dr. Moss and I spoke a little bit about who is eligible, and it is a segment of essential workers right now. So public safety, emergency responders, teachers, anyone in the food chain, and childcare, I maybe missed, healthcare workers, obviously. And it is not all essential workers. And there was a question about water and wastewater workers. We are waiting for additional guidance from the state on opening up to additional essential workers. And hopefully that is coming in the short term. But for now, those are the eligible categories of essential workers. So I did want to address that one piece of information that was out there. So I want to thank Tracey, Lewis Taylor, and Dr. Moss for being here, for your partnership with us as a state, but also with each other. I mean, I have to say, one of the incredible things that has come out of this pandemic is seeing county health departments across the entire Bay Area in coordination. Who thought government agencies could be that coordinated before this pandemic? But we've seen it and they've done it, and now we should expect it going forward. And then seeing, the public-private partnerships that we have seen blossom at the Alameda Fairgrounds with incredible public health benefits. So thank you both for everything you do for our community. It is paying off, and we're seeing it in the numbers, and we're seeing it in our ability to do more of those things that we've been dying to do for a year, like send our kids off to school. So thank you both for being here. And for anyone whose question didn't get answered, and we didn't get to them all, and I do apologize, know that my district office continues to be available to you to answer your questions. You can shoot us an email, or we can be reached at 328-1515. Also, please feel free to reach out to any of your healthcare provider, the county, or anyone who can answer your questions. And so, as we mentioned, I do want to close by saying, while the percentage of people in Alameda County, a quarter of eligible people have been vaccinated, many of our seniors and our most vulnerable have been vaccinated. It's all encouraging, and we're seeing the fruits of that labor, but we do need to remain vigilant. And so I can't leave you without saying, please continue to wear your mask to maintain that social distance that Dr. Moss talked about. Wash your hands, do all the things that have been keeping us safe and will continue to keep us safe. And hopefully one day I will finish these without having to say that. And we'll be back in person, perhaps in an auditorium all together. So thank you all. And it's been a pleasure to be here and provide this information with these incredible members of our community. And I wish you safety and wellness moving forward. Thank you.